When your child is diagnosed with a heart problem, it's normal to feel overwhelmed. You might feel scared, anxious, or helpless as you try to understand and manage your child's condition and how to care for them. We thought it might be helpful to share some important things to keep in mind when talking to your child about their heart problem.
It's important to use simple, positive language. You can explain to your child that their heart is a very special muscle that helps move blood and oxygen around their body. You might say, "Your heart is like a pump. Sometimes it needs a little extra help to keep everything working well, just like we sometimes need help with other things." Next, avoid using scary words like disease or problem, as they can sound upsetting. Instead, try using words like special heart or different heart. For example, your heart works a little differently than other hearts and it might need a little extra care to keep it strong. If your child has symptoms like feeling tired, you can explain this to them in a simple way. Because your heart works extra hard, you might feel tired faster, and it's okay to have a rest when you need to. When it comes to hospital visits, reassure your child. Let them know that the doctors and nurses are there to help keep their heart well. You could say, "The doctors know a lot about special hearts, and they're here to keep you feeling strong and healthy." Give your child the chance to ask questions and answer them as simply and honestly as you can, using words that they can understand. For example, if your 9-year-old asks why their heart is different, you could say, "Everybody's body is different. We all have things that make us special, and one of those things that makes you special is your heart." It might help your child to meet other children with a heart condition so that they don't feel alone, and they can connect with others who understand. Ask your heart team about local heart charities where this might be possible. Focus on what your child can do. Let them know that they can still play and have fun, but sometimes they might need to take a break to let their heart rest. You could say, "You can still play with your friends and do fun things. You just might need to have a rest sometimes." Lastly, remind your child that you are always there for them and that you, their family, the doctors and nurses are all part of a team. Keep talking openly with your child so they feel supported and understood. For example, you could say, "No matter what, we're all here to take care of you, and you can ask us any questions anytime." By keeping your explanations age-appropriate, honest and supportive, you can help your child understand their condition in a way that feels safer and easier to handle. Sometimes families need extra help to deal with how they are feeling. This is where psychological support can help. Clinical psychologists offer support by helping families deal with the emotional challenges that come with having a child with a heart condition. They work closely with your child's heart team to provide personalised support that fits your family's needs. This can include, but is not limited to, helping you to understand their heart condition, managing your fears or anxieties. This might be because they are due to have a heart operation or other treatments that are worrying for you. Offering coping strategies for both you and your child. Supporting your child through difficult emotions or behavioural challenges. Talking about tough topics like scars, hospital visits, or difficult memories. Psychological support isn't just for parents. Your child may also need help dealing with challenges such as not fully understanding their condition, preparing for an operation or medical procedures, or feeling different from their friends. Clinical psychologists can help provide the tools your child needs to feel more confident, prepared, and supported. When you meet with a clinical psychologist for the first time, you'll talk about the challenges you or your child are facing. Together, you'll create a plan for support that focuses on your goals and what you want to be different. They can also work with your child's heart team, with your permission, to make sure everyone understands the emotional and psychological challenges your family may be going through. Psychology services are flexible and you can receive support in the way that works best for your family. This might be face-to-face, online, or over the phone, depending on what's most convenient and comfortable for you.
Remember, you don't have to go through this alone. Support is available to help you and your family through the emotional challenges of having a child with a heart problem. To learn more about how psychology can help, talk to your child's heart team.